Well, at this stage, with the corporate report starred, I'm happy to open questions from items that are on the agenda of the public board meeting to members of the public. If there are other questions, of course, they would be taken up through other channels. If you can ask the question and say who you are, that would be great. Thank you very much.
Yeah, my name is John Green, and you may well say this isn't on the agenda, but it is about trust performance that my question is about, and it's specifically about Southern Health. I was a governor at Southern Health for 4 years, but recently resigned because I lost confidence in the whole system. Since the Mazars report, governors have tried to do the job of uncovering what has happened, to learn from it, and to get some sort of results. But all that's happened is that there's been a huge cover-up that's taken place. Now, I've raised this with ministers and members of Parliament, and around about May, the NHS Improvement put in an interim chair, which I hoped would be an improvement, but it just brought further cover-up, cronyism, and incredulous decisions as far as the public is concerned. I've raised the matter with NHS England because I'm writing a paper on this. I've got an interim paper which you might be interested in as to what I think the problems are. And the fact is that the unexpected deaths in the trust are not just due to what's happening in the trust. NHS England, NHS Improvement and the CQC are, in my view, all involved in terms of things that have gone wrong or not operating very effectively, which have contributed to unexpected deaths in the trust. This is what I've written about, and I propose to write a fuller document using the trust as a case study of comprehensive failure in management throughout the NHS. Now, I've been to the ministers. They've referred me to your good selves. I had hoped in May that things would have changed, but they didn't. They got worse, and it's become a farce there. In fact, I've been to the meeting with NHS England this morning, raised issues with them, and they will come back to me. But they've equally referred me back to yourselves. Now the question is, where do I go next to try and get some sort of result from this? Because of my frustration and resignation, I went to the BBC, and with one or two others was instrumental in obtaining a half-hour programme called Trust Broken, which was shown on the 7th of September. So in other words, going through the system to try and get change and reform, I didn't get anywhere. So in the end I turned to the media, as others have done. And I produced a paper here, which you're welcome to have a copy of, which they used as a basis of foundation for that programme. I intend to write a fuller document with a view to getting another programme, to bring to attention that how dysfunctional the NHS is. There's 3 organisations running this NHS, and it appears that it's unclear to everybody where their roles begin and end, or who is responsible. It appears that no one is responsible, and yet in terms of quality improvement, identifying the cause to get change is critical. At the same time, nobody seems to accept responsibility, so I'm bounced around everywhere. But the grassroots of it is that we have an organisation in Hampshire that is providing community mental health services, and it's in a bad way. And I just feel that this was the only place I could come to express that view, and would like your view as to what happens next in Southern Health, because I've clearly lost confidence in the system, and yet somehow we collectively have got to get this together.
Well, look, thank you for airing that here. I'm not going to respond to what you've said, but I think your specific question is who do you come to and what do you do next? Well, can I make it very clear that the answer is we arrange a meeting with me and my chief executive, with you, not with press and not with the BBC present. We have this discussion with you and we reassure you as to what we are doing. If you then feel you need to come back to a meeting or to go to the media after that meeting, then that is clearly for you. But I think in specific answer to your question, what do you do next, the two of us and probably with Kathy as our medical director are very happy to have a private meeting with you, provided you recognise that is a private meeting which we talk about this matter.
Yeah, I greatly appreciate that, sir. Thank you very much indeed.
Good afternoon, Board, and Ed, thank you for letting me speak this afternoon. I must say that I do concur with what the gentleman in the corner has said, and if I may just say, I feel disappointed that your response was as defensive as it was to his statement, and I feel personally that this is such a public matter and people have lost their children, their sisters, their mothers. Because it's been played out so publicly, I think it would be good for you to give a public response and respond more in public, because I think that's what we in the NHS all want to happen. We're talking about, Lord Pryor's talked about intelligent transparency, and I think that we all have to let down our guards somewhat and let that process take place. That's a painful process, and it means that some of us might be culpable in what we find, but I think we have to stand up as adults and mature individuals and accept that. That's just my comment. Can I ask my question now? Basically, I've listened here today about the service transformation plans and the new models of care, and I think we're all, I was interested in what you were saying about sort of safety governance around these and ensuring in practice we have robust measures to keep patients safe, because what we're talking about is change. All these things are about changes, and how do we keep patients safe through that and ensure they get the treatment and care that they deserve in a safe way. Experience demonstrates that we're very poor at doing that. I have horrific personal experience of this because my late mum and stepdad were in the mid-staff disaster of which this organisation was part. I don't think that the mid-staff's inquiry has really changed anything. One of the fundamental points of safety in the NHS is safe staffing. NICE has been scrapped. I'm now aware that this organisation and CQC are in conflict because you've said that One Trust is overspending on agency staff, but CQC have actually said they've got a problem because they haven't got enough staffing. So are we all in agreement, because I feel as if I'm sort of badgering you now and I'm being aggressive towards you and I don't want that to come across. Are we in agreement, Ed, that we all want to improve? Are we in agreement with that?
Well, I think it's an obvious statement, isn't it, that the answer is yes.
Okay. So what I've done, what I'm doing at the moment is one of the fundamental things, and I've raised this before because this was attributable to some of the things that happened at Stafford, and if it worked at Stafford, some of the harm that happened to my late parents probably wouldn't have happened, and it certainly wouldn't have happened to other people. And I'm talking about whistleblowing governance. And so what I've done is I've discovered that through working with other campaigners, there's an awful lot of people over the last 5 years who've been super gagged. So I've launched a national campaign to lift NHS super gags over the last 5 years so that people can speak out. And what I'm doing to achieve this is, instead of going to the people who are super gags, because that's quite difficult, though some people do still come forward under the radar because they're very distressed about wanting to speak out about serious safety issues that they feel still haven't been addressed. So what I've done is I've been going to people who are putting these in place and listening to their view on them, and no one yet has given me any good reason as to why they should be in place, and no one has been able to suggest to me that they're not a patient safety risk. No one yet has disagreed with me, and I won't tell you who those people are because I want to gain their trust, and then I want them to come forward with me and make public statements. Now, I'm also aware...
Jade, I'm very conscious that you're making quite a lot of statements here. I'd like to get to what your question
Okay.
is for
I'm
this
coming to
board
my question.
now. Well, can we get to it quite quickly,
I'm coming
please?
to my
Because
question.
it
My
seems
que-
to me that you're using this public meeting as a way of making a much broader set of statements rather than asking the question.
And
So
that's
can we just
exactly
ask the
right.
question, please?
That's exactly
Or can we just
right,
ask the
Ed.
question,
I will,
please?
indeed, because the background is very important. So my question is, it's a challenge to the chair. Basically, I'm, in terms of improving, I want to place a challenge to you, and what I would like to do is for you to support your CEO, Jim Mackey, because I understand that over the last 5 years, the NHS Improvement CEO's Trust, which was Northumbria, has super-gagged 45 staff. So my challenge is, will you, as leading by example, support Jim to help lift all those 45 super-gags so that those staff can speak out? So if there's anything there that needs to be dealt with that wasn't dealt with at the time, that can be now implemented.
There were no super gag clauses in any of those compromise agreements. There were specific clauses inserted that gave
Jim, stop
provision
there,
for
please.
people to
I'm not going to take that question in the
Okay.
board. It's a
I
specific
have the freedom
trust
of information
question.
request. It's
So-
all documented. And the
So
national
it's an
audit.
inappropriate question to ask in a board meeting. If you
I
want to
don't-
ask a general question about whistleblowing, I'll ask Kathy to speak about where we are with respect to our whistleblowing. I'm still trying to get to the
I don't
question.
think it's inappropriate,
that
and
you
I
were
think the
asking.
public will be interested
Well,
in this. But thank
I'm
you for
chairing this
letting me
meeting.
speak.
I explained at the start of the meeting this is a meeting held in public, not a public meeting, and we are not going to make this a public meeting. If this continues, I will terminate the meeting and then turn it into a private meeting.
I think you've made your position clear. Thank you.
Okay. Right.
Are there any other questions related to the agenda of this meeting, given that it is a meeting held in
the
public?
answers you've just given, which is part of the agenda. Okay? Because you said with John Green that you wanted to meet him in private. Okay, I have a letter here from NHS Improvement, which in July, which says, we fully appreciate that the Trust needs to improve quickly, and we are providing that help, working closely with the CQC and Health Watch, whose role is to represent the views of patients. When I phoned Health Watch, they'd never been approached at all. At all. And Health Watch Hampshire then checked with Health Watch England, who simply referred Hampshire back to NHS England. So they wrote out 2 invitations, one to the Chair and Chief Executive of Southern Health to meet us, and one to Mr. Mackey to meet us. We've had a meeting with Southern Health, which was extremely successful. Health Watch were promised a response when Jim returned from leave, and that was about 2 or 3 weeks ago, and they still haven't heard anything. So you say you want to meet patients, and that we are patients. I've heard the word patient very little today. So Jim, when are you going to answer Health Watch and come and meet us?
I wasn't actually aware of that. It happened.
Oh,
I wasn't seriously. It must have happened when I was away, but I'll check on that. This
well,
evening.
I've got the papers here from Health Watch.
Leave them with us and we will respond. Question there.
First and foremost, it is in respect to an item on your agenda. I heard the word regions a lot and whatever from the conversations, and I'm just wondering what opportunity NHS Improvement are doing or might be doing a little bit more about working with other arm's length bodies that have also got regional centres such as Public Health England. And the second point of that really, I know we've heard a lot about Jim Mackey this, but can I just record my thanks to Jim Mackey? Doesn't need to be what about, but just record those.
Thank you for that. We are intent and in fact in reality are joining up quite extensively with other arm's length bodies at the regional level. We are creating joint appointments between NHS England and NHS Improvement. We're working within the sustainable and transformation footprints locally and regionally with Public Health England. We are looking forward to actually creating joint functions between our organisations, because we believe that the more we put closer to local health economies on an integrated basis, the better care and the better outcomes there are for patients and the public. Just for the avoidance of doubt, that is the central part of what NHS Improvement is about. So thank you for your support for Jim. The organisation is trying its best in challenging circumstances, and it's good to know that some people appreciate what we do. Thank you very much. With that, I'm going to ask for the public meeting to be closed, and we will have a short recess before we go into our private meeting. Thank you everybody for their attention.